An antimicrobial agent or a chemotherapeutic agent must have certain ideal characteristics. One of the important characteristics is it should be selectively toxic. That means it should harm only the pathogen and not the host. It should harm only the pathogen and it should not be toxic to the host. So it should have a high therapeutic index value. Some of the other properties are it should have low MIC value. What is this MIC? MIC is nothing but minimum inhibitory concentration. MIC stands for minimal inhibitory concentration and MLC stands for minimum lethal concentration. So an ideal drug should have low MIC value. That means minimal inhibitory concentration is nothing but the lowest concentration of the drug that inhibits the microorganism. It should have a low MIC value. That means that a small amount of the drug, a very low concentration of the drug should be enough to be able to eliminate the pathogen, right? So if a drug has low MIC value, that means it is very suitable and it is ideal for treatment, because we are only administering very small or very less concentration of the drug to the host, and minimum lethal concentration is the lowest concentration which kills the pathogen. So inhibitory concentration means it inhibits the growth of the microorganism, whereas lethal concentration means it kills the microbial pathogen. So both MIC and MLC values should be low for an ideal antimicrobial agent or a chemotherapeutic agent. That means a small amount of the drug should be enough to treat the host. Then it should be a broad spectrum drug. So what is this broad spectrum? It means it should act on different species of pathogens. So if we are trying to discover a new drug, it is ideal for it to be broad spectrum. That means it should be able to treat many different infections. It should be able to eliminate different species of microbial pathogens. That way this antimicrobial agent will have a greater use in medical field. Whereas if it is a narrow spectrum drug, it can be used only selectively for one particular pathogen. It may not be in wide usage, right, because it is able to eliminate only one particular pathogen. So an ideal antimicrobial agent or chemotherapeutic agent should be a broad spectrum drug, meaning that it should be able to eliminate many different species of pathogens. Then it should be soluble in the body fluids. Ideally it should be able to dissolve in the body fluids and it should reach the target site, right? Because usually any antimicrobial agent, usually they can be different modes of administering. If it's an oral mode of administration, right, it should be actually be able to reach the target site where the infection is present and eliminate the pathogen and treat the individual. So an ideal antimicrobial agent should be soluble in the body fluids and it should reach the target site. And the last important property is it should not produce any hypersensitivity reaction or allergic reaction in the host, right? So the host, basically we are trying to treat the host from a particular infection. It should not cause any further problems in the host, right? Sometimes some of the drugs, they may end up causing some sort of allergy or hypersensitivity reaction in the host, which can be very harmful to the person, right? So this drug, it should not have any side effects. It should not produce any hypersensitivity or allergic reaction in the host. So these are some of the important characteristics that should be present in an ideal antimicrobial agent or an ideal chemotherapeutic agent.